Today, I am so excited to be joined by Dr. Dale Okorodudu. A colleague of mine introduced me to you in an email about a documentary that you were going to be launching in February. So I reached out to you, and you were so gracious and said that after that documentary was done and you had time to kind of unwind a little bit, you would be more than happy to let us interview you. So thank you for taking the time to do that. One of the things that I want to talk to you about, knowing that you are a pulmonary and critical care physician at the VA Medical Center, um, and the fact that you are the founder of Black Men in White Coats. I really want to dig into that. I really want to know more about how that came to be, how you just saw an issue and said, we got to do something about this, and just and got into action. And so I want to talk to you a little bit about that. So first, though, before we get started, I kind of want to just help people get to know you a little bit better. So if you can just tell me a little bit about where you grew up, how you became interested into the medical field, number one, and anything else you just want to tell us about yourself.
Yeah, definitely. First of all, Kiva, thanks for having me. It's an honor, a pleasure, and I'm happy that you like the film. So that gets me really excited. So thank you first of all for having me on here. So yeah, I grew up outside of Houston, Texas, a place called League City, Texas, right literally on the outskirts of Houston. I had a great upbringing, two-parent household, three wonderful elder siblings. So I was a baby in the family, and honestly, growing up, I have no complaints growing up. Right, everybody's got their challenges, but overall, I have no complaints growing up. As it pertains to medicine, why I chose the field of medicine, for me, while there were no physicians in my direct immediate family here, I did have uncles and aunts and such who were physicians, but in my direct family, no immediate physicians. As a child, my father was in healthcare in a sense. Had a PhD, so he worked at an academic center. So he was kind of always exposed. We were kind of always indirectly exposed to it through him because he does clinical stuff with his PhD. But the big thing for me that kind of really pushed me and drove me towards the field of medicine was my older brother. My older brother Daniel, he ended up going into medicine, and that's what drove me towards the career, really.
Okay. So as we talk about mentoring, then he was really a mentor to you in a way, right?
Oh yeah,
Yeah.
definitely.
Yeah.
And not just in medicine, but just in life, and not was is still to
It's
this
still
day.
today. Yep.
Exactly,
Yep.
exactly.
That's awesome. So, all right. So when you saw the data or when you started to pay closer attention to the data, what was it that sparked you to say, I got to do something about this? I cannot sit on this. I have to take action.
Yeah, honestly, a lot of it, Kiva, was me kind of reflecting back on my own life. I tell the story about when I was in college. I flew. It's funny. I had the story wrong for years. My sister corrected me. She reminded me what it really was. But I flew from St. Louis to Chicago. I was going to my cousin's wedding, and while I was on that flight, there was a woman who sat next to me on the plane. It was college in the early 2000s or late mid 2000s, I guess. I was wearing my big baggy sweatpants, big baggy hoodie. I still wear that baggy hoodies to this day. And a woman comes on a plane and she just looks at me, and for the whole flight she's criticizing me, saying, "Why do you dress like that? Do you think you're cool? Why do you talk like that? Yo, doggy, doggy." And then I was studying my chemistry book, and she asked, and I remember it's my chemistry book because the question she asked, she said, "What are you studying? You studying to be a drug dealer?" Right? This is a woman that I had never met before. But because the way I looked, she had assumptions about me, and so it's those lived experiences that made me want to do
Mhm.
something for the perception of the black male.
Oh, wow. Wow. Well, so tell me about Black Men in White Coats. Tell me about the organization and what you all do and the mission and all of that.
Yeah, at the end of the day, what we do is try to empower people. That's what we do at the end of the day. And while it's black men and white coats, obviously we have a focus on trying to get more black men into the field of medicine. Obviously, that's kind of the core of what we do based on the data you mentioned we started. But really, we focus on trying to help people get on pathways for professional success, period.
Mhm.
Primarily focusing on black men. We do it in a variety of ways. One of the bigger ways that we do it is via media vehicles, right? So I have a podcast, Black Men and White Coats, it's a documentary, which has just been absolutely huge. We thought it was going to be good, but it turned out to be really, really good, right? So that was a huge deal for us there. I write books, things of that sort. So we try to use different media platforms, different mechanisms of quote unquote entertainment to reach people and let them know about the problem, but to perhaps more importantly, to equip them to do something about that problem.
Oh, yes. And so is it based in Texas? Is that where it's based?
Yeah, yeah.
Okay.
So we're based in Texas. I'm in Dallas, but of course, we do things across the country.
Who can be a mentor in the program?
Anybody, yeah. And you know, so Black Men and White Coats is technically separate from my from diverse medicine. Diverse medicine, I have two diverse medicines in Black Men and White Coats, but the
Okay.
first thing we ever started was Diverse Medicine Incorporated. Um, I started that in 2011, and that was started as a web-based mentor organization. That was the whole idea behind it. Now we're in this COVID era where everybody's doing Zoom and virtual and stuff like this. But
Mm-hmm.
10 years ago, we were heavy on this idea like, hey, everybody needs to be doing virtual mentoring. So we started this, 10 years ago. And it was important for us because, to your exact question, we wanted to make sure that no matter where you were in the country, you could find a mentor. So
Mm-hmm.
that's kind of been our stance from the get-go.
So the documentary, I do want to talk about that because I'm telling you, I cried, I
Mhm.
was inspired, I was just intrigued by it. So I really want to thank you again for doing that. So one of the things that kept coming up in that documentary was you cannot be what you cannot see. How do you overcome that, right? Because it'll take time for more of us to get into the medical field and to help to increase that 2%. But in the meantime, what advice would you give to someone that really is a barrier? They just cannot be what they cannot see.
Yeah, it's fascinating. I struggle with that statement actually. My 9-year-old boy's like, Daddy, do you really believe that? I'm like, technically I don't, right? Because technically, if you're being literal, you can't be what you can't see. But what I try to tell people is, even though you don't see it with your eyes here in the physical, you can still see it here, right? So you can still visualize it, you can still see it in your mind. And that's something that, right now after this film, because it's just a question, I've done so many of these kind of talks, and that question always comes up, right? And
Yeah,
I don't want to lead kids down this pathway of saying, oh, I never saw anything like it, so I can't do
so I
it.
can't do it.
Because, yeah, to your exact point, there's not enough of us out there. So then we're going to be stuck in this thing like, oh, I can't see it, can't see it, can't see it. I want kids to realize, like, hey, get creative, right?
Mm-hmm.
Like, not just kids, but parents. Hey, get creative for your kids. Teachers, get creative for the kids, because there's not enough out there. So all of them are going to see a Dr. Dale or a Dr. Daniel, whoever, right? They're not going to see it because
Mm-hmm.
there's not enough out there. So you've got to get creative and think about it. And on our end, we take up the responsibility of trying to help them see it. So, we work on getting mentors. We work on getting people in the communities, getting that exposure, the videos, things of that sort. So we do our best to try to make sure they see it. But for those ones that can't see it, we need parents, family members, teachers, community members, pastors, barbers, everybody. We need them to help these kids visualize something great.
Right. Yeah. It's going to take everybody. Everybody's going to have to be on board to help us with this. I say it's a crisis, but
Oh yeah. Oh yeah.
yeah. So another thing that I wanted to talk to you about, just get your advice on. So we are starting a mentoring program at Cone Health, and it's a mentoring program for men of color. And we're not just focusing on, these are employees that already work for Cone Health. And so we know that mentoring is extremely important, and um, it's our job as an employer to develop our workforce. So we're starting with phase one to be men of color, because we looked at the numbers and we know that we need better representation, right, in the men of color, but we also need to develop the men of color that we have. And so representation is huge, and you're on that plight as well with trying to bring more people into the schools. But talk to me a little bit about inclusion and belonging, because We know that representation is a fact, right? You can see it, you know what you have. But then the inclusion and the belonging part becomes more work, and it's critical and crucial to the success of the people of color. I know you're working with schools to hopefully help them to recruit more minorities into their medical schools. What about once they're there? How are you guiding or talking, or what are you hearing about how to help them feel a part?
Yeah, I mean that's huge, and we kind of hit on that in the film a little bit. So I'm talking about retention,
Yeah.
recruitment and retention. Um, it's a complex question. There's so much that goes into that, and the bottom line of a lot of it comes down to the culture. What is the culture like? Um, and the culture thing is hugely complex. But what I can say, I think probably the best way to answer that question is we have to find ways to be intentional, right? So we have to be proactive. We have to be intentional. We can't wait till these students are having, if they have. I'm not saying they're gonna have problems, but certainly some students will have problems. We can't wait for the problems to kick in. We have to be proactive, go out there, be intentional, have programs set up that are welcoming programs.
Be intentional, and yeah, and then just having them weave it into everything they're doing. Let's talk a little bit more about mentoring, because you mentioned that your brother is a mentor. What about when you were in medical school too? I mean, of course, he's going to be a mentor for life, but who were some other mentors that you had as you were going through your journey?
Yeah, sure. Outside of my family, I always say my first great mentor was Dr. Ellis Ingram. Dr. Ellis Ingram is a pathologist at the University of Missouri School of Medicine, which is where I was at Mizzou, is what we call it, Mizzou for undergrad and med school. And Dr. Ellis Ingram, Black man, pathologist, really looked out for us. And it's not something like he was a mentor. No, like he was there for us. He would look out for us. So it was him. And not only did he um, mentor us, he showed us how to mentor. So that's why you see Black men and white coats. That's why you see diverse medicine. It's because from an undergrad, right, I was
Mhm.
engaged with his programs from a very young age.
So as we think about everybody being on board and everybody helping with the crisis, um, what role do you think physicians play? And not just physicians of color, all physicians. Like what role do you think they can play in helping us?
Yeah, so I used to tell people, and this might sound funny, but follow my logic here. I used to tell people before the most important thing they could do to support Black men and white coats was to mentor somebody. Now, what I'm telling them, at least right now for this phase of my, life, with this couple
Yeah.
of months, whatever, is to share our documentary.
Okay.
Um, and the reason I say that's a role physicians can play, because for us, the documentary is not just a film; it's a resource.
Mhm.
So in a sense, by saying share the documentary or whatever resource, it's help bring awareness to this problem.
So when you think about the young men that you come in contact with, because I think everybody knows Trip now, right? Through the documentary.
Yeah, yeah.
Everybody fell in love with him, at least I did. But so I know this you talked about you keep in touch with some of the people, that you mentor. How does that work? Like with your schedule and with everything that you have going on, how do you have to be intentional, of course, but tell me a little bit more about that and how often are you connecting with the youth?
I think real mentoring to be a good mentor, most people probably can't have more than two or three mentees
Yeah.
because you're really mentoring. Um, but anyways, to answer, kind of your question, the way a lot of people would define mentor. So one thing we do with Black men and white coats is we do quarterly mentoring lunches. So once a
Okay.
quarter, we get on a big virtual call. A bunch of kids hop on the call. You got parents on there, doctors, also a lot of people on this call. And we break up into small groups so the kids get to sit there and eat, chat with the doctors and stuff like. It's
Mhm.
virtual, so you eat at their house, chat with the doctors. So that's really cool. And then, for pre-meds, we do something. We have a coaching program every Monday night. We're coaching pre-meds. So, we do tons of stuff with pre-meds on a regular basis. And then we do clinical cases with the kids and stuff like. We do quarterly clinical cases also with the kids
Oh,
as
wow.
well. So,
That's good.
yeah.
That's some really great exposure that a lot of them definitely wouldn't have if they were not in the program. So I have a couple of questions that I call my lightning rod questions.
All
And
right.
here again, it's just an opportunity to get to know you a little bit better. So who would you say is your personal hero?
I'm a person of faith, so it's always for me. It's always going to be Jesus.
Okay.
Deep in my faith, I try to model everything I do from from that perspective. Outside of that, because that might be an unfair answer, because nobody can attain that level. It has to be my dad, right? Dad, of course, probably the hardest working man that I know. So I try to emulate him and his work ethics. So
All right. So if you had not become a doctor, what would you have become?
entrepreneur, which I'm entrepreneur in anyways,
You
but
know.
definitely it would have been business entrepreneurship.
What types of books do you like to read, or what's your favorite book? And I think favorite is a hard thing to say for a book because we like so much. But what would be, if you had to choose one, what would be one of your favorite books?
My number one's not going to be fair because my number one's going to be the Bible, but my number two
Okay.
is Up from Slavery by Booker T. Washington.
So you have kids, right? How many kids do you have?
Three. I've got their
Three, that's
beautiful
right.
pictures right in front of me right here. One, two, three.
Okay. So, do you want them to be doctors?
No, honestly, the thing that I tell them, I, I want them to do whatever they want, so we're preparing them to do whatever they want. I let them know medicine's a good field if you want to do it, and my wife is a doctor also. But
Okay.
honestly, when I talk to my kids about what they should be, I say I don't care what you do, but you need to own something. I tell them it's about ownership, so I focus on telling them they need to own something.
As you were growing up and you were seeing doctors on television, did you have a favorite doctor that was represented on TV?
Man, I mean, back then for us, really, it was just Cosby, I think.
Yeah.
I
Yeah.
mean, there were other ones, but I mean, the main one was Cosby. So, I mean, between that and the different world, those were the shows we watched,
That's
that kind
that
of
was
pushed us.
everything. Yeah. Yeah.
Yeah. Yeah, and I'll just say, I talk about black men in white coats and all that stuff like that, but I always want to make sure I acknowledge my wife. My wife is my beautiful black woman in a white coat who is, um, the rock that does so much for us. That the reason black men in white coats can happen is because, so much stuff my wife does behind the scenes and all that stuff. My brother and such, my brother helps too, but I really got to acknowledge my wife.
Well, I want to thank you again for your time and thank you for your passion and your energy and engagement around this problem.
Thank you for having me.
All right, and I hope we can stay in touch as well.